Hello. In this video we're going to look at the workflow for identifying and dealing with patients with abnormal test results. The Dawn program actually checks test results for you automatically, and in about 80% of the time it will see that everything is in range and automatically move the patient forward to the next appointment without the need for you to do anything. But about 20% of the time it will spot a test result that is outside its normal range, or where a significant drop or rise has occurred, even if the result this time is in range. Now, the easiest way to find out whether there are abnormal results which require my attention is to look on the home page at the dashboard. The dashboard comprises a number of panels, each with a different function, and they use a kind of traffic light system to alert me as to whether there's work to do. So I can see here the database and the patient license panels are green, so they're fine, but the work list panel is red. And the items that need my attention are highlighted in red. And top of the list here is the count of patients with abnormal results. So I'm going to click on that link, and that takes me through to the list view. The work list view with the flagged results filter selected. The dashboard was telling me I had 3 patients. Here is where I can see which 3 patients they are. And to view one of their records, all I need to do is click the appropriate row. Now here is Eric's record, and I can tell at a glance that he has abnormal results that are yet to be dealt with, because this banner here is red. And if I look into the interventions list, I can see the hemoglobin is flagged. All the others have a blue tick against them, but hemoglobin has 2 chevrons pointing to the left, so like a less than sign, which of course indicates that it is low. The checkbox next to it is what I would check once I've dealt with that result. And if there were other flagged results in the list here, they too would have a checkbox and an appropriate icon saying whether they were high or low. Over here I can see Dawn is recommending a next test date of November, 24th of November, and that's based on a normal interval of 8 weeks. But of course what I need to do is decide what to do about this hemoglobin result to see whether we're okay to stick with that, or whether I want to set a manual date that's sooner, and whether there's anything else that I need to do. Before I do that, I'm just going to point out this rheumatology tab, because this gives a different view of the same thing. In this view, any flagged results, so if there are more, they'll all appear in this one panel here. I can check them all off in one go by checking this checkbox. So that can be convenient if I have several that I've reviewed and want to dismiss them all in one go. What this also gives me is more detail about the drugs the patient is taking. I have that summarised here, but over here I can see the dose and the frequency and the start date. And if they were taking a combination of medications, I would see them all here. Just like on the interventions tab, I can see the recommended next test date, and if I want to expand that to get the more detail, I can see we're using the recommendation here. If I want to overwrite it, I can choose set manually this way. And just like the interventions tab, I have a close button where I can close the visit. It won't let me do that yet because we haven't dealt with the flagged results. So which of these 2 views are of the same thing, and they each have their own uses, and they're better. Each is better than the other in certain situations. As a general rule, you will probably want to use this one for dealing with flagged results. But there are two things that the intervention tab allows you to do better. One is to create referrals, which we'll look at in the next video. The next is to actually drill down and see more information about the result in hand. So I can see that hemoglobin is low, but I don't know what reference range that is using. But if I'm on the interventions tab, what I can do is click hemoglobin, and that will show me this table of the limits that are in effect for this patient. And I can see we're using the default range here, which is 130 to 180. The result is 120. That's why it's low. So what I might do is want to have a look back at the history. And what I can see is actually last time it was much lower. There may have been a reason we thought we discovered for that, which we thought perhaps was nothing to do with the medication. We were going to check it again in 1 week to see if it could come back into range. It hasn't, but it's heading in the right direction. So perhaps on this occasion, all I want to do is check that off. I want to change the next test date to be another week, and we'll see if it's back in range then. If I don't think it's an effect of the medication, I might just want to be sure that the patient's back in range. So the date there is the 6th of October. So what I'll do is just move them on 1 week to the 13th and close the visit. Dawn then creates a new visit based on this. And when it's done that, they're all good. They're ready for that next set of test results to come in. The ones I've just seen are down here. I can still see that hemoglobin was low. But if it comes in next time and it's normal, Eric will be rolled on to his next appointment in another 8 weeks' time. So I've finished with Eric now. I can close his patient record. I come back to the list view, and Eric isn't in it anymore because we've dealt with his flagged results, so he's dropped out of the list. So next I can click on Deirdre to bring up her record. Again, I can look at this through the rheumatology tab, and I can see the sodium is the problem here. It's high. So this indicator, the two chevrons pointing to the right, like greater than signs, indicate a high result. Or I can look at the interventions tab if I want to, and I might just do that here because interestingly I can see the hemoglobin is 120 just as Eric's was, but it hasn't been flagged, so Dawn is counting that as normal. Now the reason for that is if I look over here I can see that Deirdre is on a reference range. Now what a reference range is something you can set up with a set of overrides for the default limits. So what we've done here is create one for female patients so that tests like hemoglobin, which have a slightly different range for female patients to male patients, we can set up and use the female limits. And there may be other tests that similarly have different limits for female patients, and we can add those too to the reference range. And so anything included in the reference range, the limits defined there will override the defaults. And just to see that, again on the interventions tab, we can click on the hemoglobin. We can look at this table that we looked at for Eric, and I can see in addition to these default limits, we have another row now, which defines the limits for the female reference range, and because reference ranges override default limits, these are what are effective. So the lower limit is now 115, which means in this case 120 is normal. So let's return to the patient screen and let's deal with the sodium. But this time let's do it from the rheumatology tab. What I can do is tick it off here, and what I might want to do similarly to Eric, I might want to test again in a week's time. So we're current test due the 13th in this case. We've skipped onto a different date. So a week's time from that will be the 20th. So I can update that. That's showing there. That's just the same as had we done it from here, and you can see that's reflected there too. what I might want to do, if I'm not sure, if I think, you know, perhaps that's an effect of etanercept, I'm not sure, perhaps what I want to do is put a note in here that will appear in the history. So I can say where are we? Sodium high. Test again in 1 week and check with Dr. Dawn or whoever it is. Update that. That's what we call a review note, and that appears with the test results in the history. So the next person looking at the history here will see that. And it might be that we want to check those results, whatever the doctor has asked us to. So even if the sodium's normal next time, we want to manually have sight of these results. Now, that can be a problem if Dawn automatically moves them on to their next appointment. But we can stop it doing that by using something called a risk class. Now, I've got 3 options here in risk class. I've just got high risk and low risk, but I've also got one called watchful wait, which I'm going to select here. High risk and low risk are just ways of stratifying patients, and you can decide what criteria you use. If you want different risk classes, you can create them. That list can reflect any criteria you want or any names that you want. But what you can do with risk classes, which is what we've done with watchful wait, is to say that they require manual review only. So in this case, low risk and high risk don't. So anybody who's low risk or high risk can be auto-reviewed, as we call it, and rolled on automatically to their next test if all their results are in line. But anybody on the watchful wait risk class, Dawn won't do that. You will need to review those test results yourself, whether or not they're abnormal. That's great. That's exactly what we want to do this time. So we can now move them manually onto the next appointment, knowing full well that we will see the results next time, whatever. On the interventions tab, I was doing that by pressing this close button here. On the rheumatology tab, I can do the same thing by pressing the close button here. But while we're comparing the 2 tabs, let's just have a look. I can see there's a badge against this review tab, and that's because that's where I can enter or edit the review note if I'm working on interventions. If I'm working on rheumatology and I want to change that note, I just press the note button again and it pops up in that dialog. So, as I said, these are 2 alternative views. The key tasks that you do, you can do from either. And so now I will close the visit for Deirdre and move her on to an appointment in a week's time. And we will then inspect her results, whatever. That just leaves Emily in the list. And if I click on Emily's record, I can see it's the haemoglobin that's been flagged in this case. That might not be surprising. It's 105. She's on the female reference range, but if we remember, the lower limit for that was 115. But if I actually look at this icon here, it's not telling me that it's low, it's telling me it's detected a fall. And so if I look down at the history, yes, I can see it was much higher than this, the haemoglobin. It suddenly dropped to 105. That's actually a 31% drop. But the way this particular trend is configured in Dawn is to only highlight a fall if the current result is in range. So I would be expecting to see this flagged as low rather than a drop. And it isn't, which is strange. So if we have a look at haemoglobin on the interventions tab, we can see there is another set of limits in play for Emily. Here we have the defaults. Here we have the settings for the female reference range with 115 as the lower limit. But now we have also some patient-specific limits. And that has a lower limit of 105, which means this current result is just in range. So Dawn's picked that up, it's not flagged it as low, but it has detected a trend, so it's alerted us to that. Now we will go into more detail about how you add patient-specific limits in a future video, but we'll take a quick look to see where they are, and to do that we need to go into the treatment plan for this patient, and over here on the right hand side we have a tab called test limits, and we can see we've just got one test here and we've overridden the default setting for the lower limit for hemoglobin. So we've just created a patient-specific lower limit of 105. And so that's a useful feature. It means if somebody persistently is down at this level and it's kind of right for them or normal for them, we can adjust the limits for them so they're not constantly being flagged for something that is actually normal. Of course, in this case, we've had a drop. And if I don't know why that's occurred, what I might want to do is to seek the advice of a colleague. And to do that, I can create a referral. But we'll look at creating referrals in the next video.